Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Ghazi Abrar. I am a postgraduate resident at the Department of Hepatogastroenterology, SIUT. The topic of my abstract is the diagnostic accuracy of the P2MS index in prediction of esophageal varices among patients with liver cirrhosis. Esophageal varices are an important complication of portal hypertension in patients with liver cirrhosis with an estimated prevalence of about 25 to 55% with a first year risk of bleeding of about 6 to 8%. It carries a mortality risk of about 1 in 1/3 of the cases. Endoscopy is the gold standard for the diagnosis of esophageal varices, but it is a costly procedure and it is invasive and not widely available. Various studies have been employed to predict the esophageal varices non-invasively. So the aim of the study was to determine the diagnostic accuracy of the squared platelet count to the product of monocyte count and the segmental neutrophil index in predicting esophageal varices in patients with cirrhosis. It was a cross-sectional study that was carried out in the Department of Hepatogastroenterology, SIUT Karachi, between March 2021 to August 2021. All the patients aged between 18 to 65 years with all etiologies of liver cirrhosis were included in the study. Patients who are already on beta blocker or have a previous history of esophageal variceal band ligation or sclerotherapy or any history of shunt procedure for the portal hypertension were excluded from the study. The P2MS index was calculated by dividing the platelet count to the monocyte into segmental neutrophil fraction. All data was analyzed by using the SPSS version 24 and results were presented as mean and standard deviation for the quantitative and number with percentages for the qualitative data. The student t-test was used for the continuous variable while the categorical variables with the chi-square test. A p-value of less than 0.05 was taken statistically significant, and to determine the cutoff, the ROC was computed for the P2MS score and the area under curve was determined. Sensitivity, specificity, the positive predictive and the negative predictive value along with the diagnostic accuracy was also obtained for the P2MS index in predicting the presence of esophageal varices. A total of 99 number of patients participated in the study with a mean age of 41.9 years and all the patients aged between 18 to 65 years. The mean platelet count was 128.5 with the mean monocyte count of 10.4 and segmental neutrophil count of 74.6. 62 patients were male while the 37 patients were female that were included in the study, and 56.6% of the patients have esophageal varices present. HCV was the most common etiology of the liver disease, while the decreased platelet count, increased segmental neutrophil and the increased segmented monocytes were statistically significant. The area under curve showed a value of 0.801%, while with a p-value of less than 0.01. The diagnostic accuracy of the P2MS at value of less than or equal to 16.2 showed a specificity of 83%, a positive predictive value of 82%, and a diagnostic accuracy of 81.8%. In conclusion of our study, the P2MS index has a high diagnostic accuracy and specificity in predicting esophageal varices, and it can be utilized as an easily available non-invasive tool for the prediction of esophageal varices. However, further studies are needed to validate this score. Thank you.